Hello, I'm Amanda Victoria from Group 29, and I'll be presenting my case history of the topic of general trauma. Patient's name is Eugene Cho Humeng. He's age 25. On physical examination, during general inspection, the general condition was unsatisfactory, middle grade, and he had a lying posture with calf being straightened and fixed by the splint. Other system, there were no abnormalities were found, however, in local status. There was exposure of the bone fragments with obvious protrusion of the bone fragments under intact skin. There was wounds on the skin. The color of the skin was reddish due to bleeding and bruising. There was swelling on the right leg. Temperature was decreased. Sensitivity is normal. Movement, both active and passive, was not possible due to immobilized by the splint, and tenderness was present. Pulsations of the arteries on the right leg was weak. Results of the laboratory test, so complete blood count, hemoglobin level was decreased, red blood cell was decreased, hematocrit and platelet count was also decreased. And then we also did a urinalysis as part of the screening test. The color of the urine was dark yellow, and the specific gravity was actually increased, and urine output is actually decreased, which is 60 milliliter per hour, which should be 70 because the patient's um, body weight is 70. And the hemostatic test system also have proved a significant increase in the APPT level, the dimer, INR, bleeding time, and ESR has all increased. As for the results of the instrumental tests, other instrumental tests or screening tests like ECG and the X-ray was normal. However, an X-ray of the foot was taken, and we can see there was complete fracture of the tibial bone, open type of tibial fracture. The direction of the fracture line was oblique, and location was the diaphysis of the tibial bone. And so the final diagnosis was a complete open tibial fracture of the right leg. So the treatment plan we gave for this patient was both medical and surgical. Medical is where we corrected his blood loss by normal saline and 10 minutes of 1 liter incubator region. And then also we gave him tetanus toxoid and antibodies with ceftriaxone parenteral and also metronidazole and also morphine to reduce pain. And for surgical, so preoperative epicrisis was done, and this type of open reduction and internal fixation. Surgical operation was an urgent type, indication is absolute, and due to second degree of hemorrhagic, and also contraindication is just local infection. Risk of surgery was not moderate. Risk of bleeding was high. Risk of thromboembolic complication was moderate. And type of anesthesia that we give is spinal anesthesia, which is 0.75 bupivacaine in 8.25% of dextrose for 50 milliliters. And then without the surgery, chances to success is 20%, and with the surgery, chances to success is 90%. So for pre-operative checklist, everything was done. And so we have checked the blood type A, which is type 2. And also we ordered for volume of 2 liters due to second degree of blood loss. Other than that, all of the pre-operative checklist was done and signed. So next is the intraoperative examination. So the surgery started at 11:30 a.m. and ended at 2 p.m. So vital signs were taken. So his pulse, respiration rate, blood pressure, and consciousness level were within the range, except for GSC was 14. And then temperature we measured also, it was 36.5. His skin during the starting of the surgery was moist, however, and end of the operation it was pale, and the intravenous access were there, and then color transparency was transparent along the way, and type of catheter we gave was Foley catheter. And next is the post-operative care of the patient, which is the first day. So right after the finishing of the surgery at 2 p.m., so his pulse from 90 gradually decreased to 75 within the normal range. His respiratory rate was also decreased from 20 to 19 and 18 and was stable for the rest of the day. And the blood pressure was also measured from 110 slowly increased 115 back to 120 at the stable. And then consciousness level right after the surgery was 9 and then slowly increased at 3 p.m. 11 and then 6 p.m. 14 and slowly back to 15. and then his skin was pale right after the surgery and normal back 1 hour after the surgery. And then type of diet was still we keep NPO for the rest of the day. And as for the catheter type, Foley catheter is still going to be till the rest of the day. And then we also did a local examination of the right leg where the part of the surgery side. So everything was normal except movement is still passive, and also state of dressing was wet and dirty. And dressings they are changed 3 hours after the surgery. And then post-operative medical chart for the day 1, we giving ibuprofen, cefazolin, and oxygen, and also at from 6 o'clock, 10 o'clock, 11 o'clock, and so on. As of day 2 of post-operative care, vital signs are again measured from 6 a.m. and rest throughout the day, and then the diet we stopped of NPO diet to full liquid diet at 9 a.m. as well as Foley catheter was removed at 9 a.m. We also rechecked again for the local status. Movement was still passive and state of dressing slightly improved, dry and clean, and dressings are changed only once a day. And then post-operative medical chart was also kept, and ibuprofen, cefazolin, and oxygen were given. And also for day 3 of post-operative care, everything seems to be normal. Diet by mild restriction to full liquid we have given, and Foley catheter is completely removed from day 2. And local status also, the movement is still passive and state of dressing is also dry and clean and are also changed once a day. So in conclusion, I can say that the patient's fractured leg is recovering and overall his health is recovering. And so this post-operative care is yielding a positive result, and it is anticipated that the leg will require a minimum of 3 weeks for complete recovery. And with that, he is likely to be discharged.